Welcome to my channel. Today I will be telling how to flag treatment emergent adverse event records and what needs to be considered for doing so. Everyone starts with the AE start date and compares it with the reference start date or the treatment start date. Most of us would also consider the reference end date or treatment end date for comparison. We would then flag an AE as treatment emergent adverse event if AE start date is on or after treatment start date and on or before treatment end date. In this case, we just assumed that a severity level change is captured as a separate AE in the AE dataset with an AE start date as the date severity changed. When we have crossover studies where subjects undergo different treatments, deriving treatment emergent flag and tying them to the right treatment during which the AE occurred can be tricky. There are usually two approaches that we can take to deal with this situation. The first way is to use the TRT-A variable to identify during which study drug treatment did the AE occurred. In the shown example, we can see that the AE headache and nausea occurred during drug A treatment, whereas itching adverse event occurred during drug B treatment. In addition to TRT-A, A period also shows the period during which the respective AE occurred. The second way is to create a multiple treatment emergent flag variable with a single adverse event dataset. In this shown example, we can see that since headache and nausea occur during the period 1 while undergoing drug A treatment, TRT-EM1FL is populated, whereas the itching adverse event is for that record the TRT-EM02FL is populated, reflecting that this AE occurred during the second period while the subject was exposed to drug B. Second scenario is where the severity changes is captured differently in different studies. In the shown AE dataset, subject has an AE worsening of ovarian cancer that has started on 18 September 2011 and ended on 6 October 2011. However, the severity of this AE worsened on 5th of October 2011 and is captured as a separate variable. This whole episode of AE is captured in two observations with the same AE SPADE ID. One observation for the actual AE and another for the same AE with change severity. Now, if the treatment start date for this subject is, let's say, 5th of October 2011, this AE would not be considered as treatment emergent adverse event by just looking at the AE start date and end date. This dataset has to be reconditioned in order to bring the date of severity change into the AE start date. The following snapshot of the same dataset after reconditioning shows the AE start date as the date when severity changed from 3 to 5. This dataset can now be used with the TEAE algorithm, and the second observation will now be considered as the treatment and emergent adverse event. Now, if this episode of AE was captured as just one observation with severity changes captured in a separate variable, then we would have split the observation into two in order to create the same dataset as shown. Now that we have seen the above scenario, consider a similar situation with the severity level getting better. Yes, anything can come in the raw dataset. Taking an example where if the severity changes from 3 to 2 or 1, in this case, on only considering this start and end date in the TAE algorithm, then the second observation will be flagged as the treatment emergent adverse event, where it shouldn't be considered as the treatment emergent because the severity has improved. Hence, additional programming logic needs to be deployed to check the severity level changes for the same episode of AE and should flag only if the severity wasn't and not when it improved. Another scenario is where we have partial or missing adverse event dates. Consider the following scenario where we have the partial AE start date as the March 2014, which is that the day part is missing. And similarly, for this particular scenario, the partial AE end date is only having the year part, which is 2014. Now, if we impute these partial dates based on the first day, first month approach, we will end up getting the imputed A start date as the 01 March 2014 and the imputed A end date will be 1st January 2014. Apparently, the imputed A end date is before the imputed A start date. This is a potential problem in our analysis. Our way to ensure that this doesn't happen is to use the first day first month approach for the start dates and last day last month approach for the end dates. So using this approach, in our previous example, the newly imputed dates would be like this, which is the imputed A start date will become as the same as the 1st March 2014, but the imputed end date will become as 31st December 2014. And now we can see that the end date is after the start date. An important factor that needs to be considered while driving the treatment emergent adverse event flag is the washout period. A washout period in a clinical study is the period allowed for the administered drug to be eliminated from the body. Any AE that occurs during the period while traces of administered drug remains in the subject's body may be considered as treatment emergent adverse event. For this reason, a washout period in days is also added to the treatment and date in the algorithm for driving the treatment emergent adverse event. Different drugs may have different washout periods and hence should be carefully set after discussion with the investigator and statisticians. That's all for now. Thanks for watching. Let me know in comments if you want me to cover any specific topic.